Hi, good afternoon, everyone. Thank you for joining the Female Implantology Team webinar. We are so excited to have you with us today. And I am honored. My name is Cassandra Gordon. I am the Director of Biologics Product Marketing with BioHorizons. And we are super excited to have our panelists speaking today on just how they're coping with managing personal and professional responsibilities, and what it looks like for them, and how they're kind of moving forward through all of the pandemonium and all this coronavirus, with impacting both personal and professional lives. So today I'm joined with Dr. Tara Aghaloo, Dr. Jennifer Doobrow, and Dr. Bobbi Stanley. And I'm so excited. I think you guys are going to really enjoy listening to what they have to say today. So I'm going to turn it over to Dr. Tara Aghaloo.
Great. Thank you so much, everyone, for joining. And thanks to our great panelists for agreeing to be here and share some of our insights into what we've been doing as female implantology practitioners. So I will introduce you all, and then I'm going to ask you some questions. So first, we have Dr. Jennifer Doobrow. She lives in Birmingham, Alabama, and has continued her father's legacy in private periodontal practice about an hour outside of Birmingham. She serves as the corporate advisory chair to the Southern Academy of Periodontology and sits on several committees for the American Academy of Periodontology. She has published several articles, involved with several study clubs, and is very active in a variety of dental organizations. I honestly don't know how she balances and juggles everything, so we're going to hear about this all today. So we're gonna start with you, and I'll ask you some questions, and then I'm gonna introduce Bobbi, and then we'll go with the same questions to her. And then at the end, we'll have some questions from the panelists. In the meantime, as we're talking or as you're thinking, all panelists can type them into the question box, and then I will read the question and address it to one of our panelists. So thank you again, Jennifer, for joining us. So I guess I want to ask about, I know that you have a family, you have a child at home, and so how has been balancing, work, or what semblance of work we've been able to do while having a child at home who's supposed to be at school?
Well, first and foremost, I just want to say it is an honor, a pleasure, and a privilege to be with the three of you, I guess Cassandra, I'm going with you on the three of us on this panel, and all of you that are in attendance. We are all going through this together. We're certainly in different boats. I've heard a lot of these. We're weathering the storm, but in different boats terminologies. But we all are in this together, and I truly believe this in my heart of hearts. We are in the best profession. We really are. It is such a blessing to be in the profession of dentistry, however you practice. And so I applaud each of you for being on the call, but more importantly for what you do and truly being a part of the best profession ever. Of course, I'm biased, but so before I answer the question, as Dr. Aghaloo had alluded to, I had the unfortunate situation that about a little over 12 years ago, actually coming up in August, it's been 12 years, between the intervening summer between my first and second year of my periodontal residency at the University of Alabama at Birmingham, my dad, who was a practicing periodontist, he had 2 locations, he had 8 restaurants, fast food restaurants. He passed away suddenly. And so I lost my mentorship. I lost my guidance. I lost my teacher before I even started, really in the infancy of the program, if you will. So those of you that did residency programs, I mean, we don't even realize what we don't know until we realize we don't know it. And I realized really, really quickly that we just have to pick up the pieces. And with adversity, and I mean this from the bottom of my heart, with adversity comes opportunity. And I say that again because I have to tell myself that as I lay my head on the pillow without a lot of sleep right now, much like many of you. I think we all are experiencing insomnia in some way, that with adversity comes opportunity. And absolutely, I can't answer that question without thinking about it in that state of mind. I experienced what I never thought I would experience, and now we're all experiencing things that we never thought we would experience, and we will get through it. And before I answer, I do want to share a quote with you that it sticks to me, and I think it's anonymous because I haven't seen I haven't seen an author yet, but when you can't control what's happening, challenge yourself to control the way you respond to what's happening. That's where the power is. And I mean that from the bottom of my heart. Tara, as you mentioned, yes, I have a family. By the grace of God, I've got time. This is the first time, I think, in my life, in my almost 40 years of life, that I can say I have time. And so it's been a challenge in a lot of new ways, right? We're balancing. I know before we started this, we talked about our kids are at all different stages in their lives. I've got an almost 10-year-old. He'll be 10 this month, so he's in the other room. So I'm going to kind of make it quiet, trying to figure out like the Zoom birthday party, you know. But homeschooling at the same time, doing these webinars. I mean, many of you probably have this. I mean, this is my COVID book. Y'all, I mean, I'm anal retentive, okay? The start date was March 17th, 2020. I don't know when the end date's going to be, but we have to be organized. We have to prioritize, and we have to realize what's really important in life.
Great. No, thank you. That's wonderful. And, you know, you talked about staying at home with your son. What have you done how have you maximized this time with your family?
I have praised his teacher a lot.
It's definitely taught us to really appreciate the teachers.
Oh my gosh, God bless the teachers out there, for real. And we're all teachers in our own way, but I never imagined how hard 4th grade math could be. Thankfully, y'all are going to laugh about this. The very first assignment he had for the first week was all about science and anatomy. I said, thank the Lord. At least I've got something that's applicable. He's looking in as I said that. But what are we doing? I mean, we daily are doing, he's doing his schoolwork, and I'm involved in it as little as I need to be or as much as I need to be. I've never had that opportunity before. I'm learning as a 4th grader. And I really mean that. I mean, I'm learning to learn as a 4th grader, which is important moving forward, because the way we learned 10, 20, 30 years ago is so different. We're taking a lot of walks. I mean, I experienced watching my child. He's 10. He was okay at bike riding. I've watched him soar. You know, I'm able to watch him do Zoom golf lessons and grow as a human being and as an adult. And there's no greater gift than watching that. And then from a spouse standpoint, I mean, being home all the time, with each other. And I'm not a domesticated individual to the level of that maybe my spouse would like me to be, but we're doing that together, and we're watching each other grow in our strengths and helping each other grow in where our weaknesses are. So it's been a balance. I'm not going to tell you it hasn't been. But you have to appreciate these moments, because like I said, the most important gift that we have right now is time.
Absolutely. That's great. How are you staying healthy mentally and physically? Because this is definitely a challenge during this time.
Oh my gosh, that's such a great question. The mental aspect of this, obviously, to me, I think is the hardest thing for all of us to comprehend. And we're all in the storm together. We're all traveling in different boats. So we're all going to deal with the stress differently. What I have found the most important thing is being organized, having a plan, working out the schedule for the day, and knowing it's okay that I can't stick to that schedule. Y'all know this. Like, we all are so schedule oriented and task oriented. Things are going to change when you're homeschooling over here and bike riding over here. I have found something called Headspace. Have y'all heard of Headspace? It is awesome. And right now it's free to, I think, medical care providers and healthcare providers. It is an app, and it allows you to, we talked about, Tara, about meditating. I mean, it allows you to meditate. It teaches you how to breathe. I'm doing it now. Never did this before in my entire life. I'm doing it with my child. Before we go to sleep, we sit there and we listen to the app, and we breathe, and we close off our eyes and our mind and our body and our soul, and talk about a bonding time. I mean, I'm getting emotional thinking about it. And that's what we're going to continue to do from now on. I mean, I really am. Y'all know we're women. We can get a little emotional about things. He's smiling and he's going like this in the corner, okay? So Headspace has been available. And then I try to find time every single day to work out in some capacity. It may be 10 minutes of doing planks and push-ups. It may be an hour of doing my Pilates. But I have made a priority to find that time.
That's great. Yeah, I mean, I'm sure that, this is sort of going to resemble the freshman 15 of college, where we're all doing a little less exercise and probably gaining a bit of weight, I can imagine, and I can attest to. So definitely. Great. And last question for you, Jennifer, how do you envision restarting your clinical practice as a practice owner? I mean, I know there are a lot of things out there. So do you kind of have plans set up for how that will look?
Yeah, so great question. So several different things that we've had in place. So from the very beginning, like I said, I made a plan, like what's important right now. What was important to me was my team, as far as clinically in my office. Now, obviously, we've talked about family, but my team, my patients, my study club, and my referring doctors. So as I said, I'm a periodontist. So I practice, as Dr. Aghaloo mentioned, in an hour away from Birmingham, so rural Alabama. So our referral base is rather widespread. And so what's been very important to us is communication. And obviously, we're all communicating with right now. I think there's a little reverb. Is that better now? Okay, cool. So when I prioritized, I realized what's currently going on. Well, what's gone on in the past, what's currently going on, where we're going to be in the future, and what the new norms may look like. And so, hi, thanks for joining us. Just to kind of give you all an idea out there, what I've done is I've done roundtable or coffee talks with my team. You did not want to call them a team meeting or a mandatory team meeting in our case, because we furloughed, unfortunately, our team for the time being, including myself. I mean, I never imagined 7 years going post-college was I going to be unemployed, but it's what we had to do for the business and for perpetuity's sake. So we had roundtables or coffee talks with our teams. That's what we called it, okay? I have done, and we're going to continue to do weekly Zoom calls with my study club. I'm a director of a Seattle study club. It's called the Alabama Study Club for Dental Excellence. And we've done it the same day, each time, each week. And we've had an agenda, so it's been organized, kind of like what we're doing here, but then we have free opportunity to talk and ask questions. And I can tell y'all, it's been such a God thing, because that interaction has allowed us to communicate at a level that we would never have communicated. And for those of you that are study club directors or even a part of a study club, that sets you apart and makes your individuals that are with you believe in you and know that they can turn to you. And my phone, my texts, my calls, my emails have just blown up because we're in this together, and they know that I'm going to do whatever I can to guide them through it. So that's been of the utmost importance.
And you may even decide you want to continue some of these activities that you've developed even post-COVID.
Absolutely. So to answer your question, we were told by our governor as of Tuesday that we are, like Dr. Stanley will mention, that we are considered, essential at this point, and we can perform elective procedures. So as of this evening at 5 p.m., so just coming up, we will be allowed to open for business as far as doing non-emergent, so our regular practice as usual. So with that being said, what we've done is tomorrow I'm going to have a full-day training session with my team. It's going to be in person. I've got a PowerPoint and I've got handouts that I'm going to be giving to them. So I recommend to everybody be very well thought out. Your team needs to look at you as the leader. And I've been, like all of us on this call right now, I've been on numerous overloads of webinars, right? Yeah. And that's what that binder is. So when I go to my team, or I go to my referrals, or I go to my study club, I can say, this is what we're going to do, and this is based off of whatever information we have at this moment in time.
Great. Well, thank you so much, Jennifer. We're going to have questions, of course, at the end. So I'm going to move on to Bobbi Stanley. Dr. Stanley lives in Cary, North Carolina, and is in practice with her husband at Stanley Dentistry, as you can see on her shirt. It's a great logo there, too. She has been in practice for 26 years and now primarily restores their implant cases and focuses on the business side of dentistry. She has 4 children and 1 foster daughter. Her son is a high school senior, and her daughter just got married, and hopefully we'll hear a little bit about that possible Zoom wedding. And she's a pilot who loves to fly. So Bobbi, thank you so much for being here with us.
Thank you for having me. I'm super excited.
Why don't you tell us about this wedding on Zoom?
Sure. So our oldest daughter, our only daughter, got engaged 2.5 years ago, and she wanted to wait 2 years to have her wedding on 4/4/2020. She thought that was such a cool thing. And so for 2 years, she's been planning this beautiful wedding that it's just one of the princess weddings that you could just, imagine. And 3 weeks before the wedding, she got notice that the governor said no more than 100 people. And then 2 weeks before the wedding, he said no more than 10 people in a gathering. So we had to scrounge and decide what we were going to do. And I asked her to just put it, delay it. And she said, no, I really want this date. And so they thought maybe they'll do a beach wedding on the beach because he's from the beach and he always dreamed of having a beach wedding. Well, then they closed the beaches. And so then we said, oh my God, what are we going to do? And so we scrambled like in 3 days to put together this beautiful backyard wedding. It was absolutely perfect. And the funny thing is, we woke up that morning and the electricity went out. And in the 12 years we've been in our home, the electricity has never been out. So my son said, maybe you need to speak to the big guy upstairs and make sure this wedding's we were like, oh my gosh. But it was beautiful. It was his parents, it was us, our boys. Our foster daughter could not make it in because she's in Alabama, and his siblings couldn't make it in because they're in various areas. So we did a Zoom wedding, and it was so magical. It was everything you would want it to be. She has delayed the wedding ceremony, the reception, until August. Luckily, there was one date at the hotel where she wanted to have it, and so she's going to do that in August. And I'll tell you, I'm not sure she needs it. I'm not sure I need it. It was everything we could imagine, just in that little tiny space that we had. We did the first dance, we did the toast. It was perfect. It was beautiful.
How many people did you have on your Zoom wedding?
Gosh, we probably had, it was a last minute thought. Literally, she was putting her makeup on and she said, why don't we Zoom a couple people in? And I said, oh my gosh, okay. So we just sent out a couple of notices, and I think there were about 50 people that
Wow.
somewhere give or take 50 people who actually got the notice. And there were a lot of people who did not, but it was really like 30 minutes before the ceremony, we said, oh my gosh, let's Zoom it. So, it was good.
That's great. That is great. So that definitely answers our question about how you're spending quality time with your children and your family. Definitely.
Yeah, it's been quite interesting. We have a child at NC State who actually has a house at NC State. So we've seen him the least because he's quarantining within himself. But we've seen him some. But we also have an older son who has come home, and then we have a senior who, we had to finish his senior year with him. He just finished his last class yesterday, his last high school class. So, and he's my baby. So that's been interesting to, walk him through the online courses and making sure everything's getting done. And we're crossing our fingers for our graduation ceremony. We're not sure yet, but we came to our lake house. It was funny. About 2 weeks in, we said, why don't we go to our lake house? We never have the opportunity to go to our lake house. We go a few weekends out of the year in 1 week, and that's it. And so we came up to our lake house, and I said, I'm not going home. This is great. I mean, it's about an hour from home, so it's not a big deal to go home. And so all of a sudden, we had these projects we wanted to do. We wanted to build a shed because when we come out for a week at a time, we'll bring a lot of our gym equipment. And so we built this really super nice gym shed that's going to hold all of our gym equipment. So when we come up now, everything's here. And so that's been really cool. And now we're building a second shed so we can get all the skis and the life jackets and everything out of the boathouse and put it in that shed. And then the boathouse can become more of almost like a party boathouse. Like we can have beverages down there and just really enjoy it. So it's been nice because our boys have been literally building with my husband. We also went over to our daughter's house and built a fence in her backyard. I mean, it's been incredible. It's been great.
So a lot of family home projects together.
Yes.
Great.
Yeah. Good spending time together.
Everyone can benefit from that. So that's wonderful. So obviously this is how you're staying healthy physically with all of this manual labor that's going on. How are you staying healthy mentally?
So a couple of things. First of all, physically also, one of the best things I did about a year ago is bought a Peloton. And it has been a blessing in this. Wow. So there's a Peloton dental group on Instagrams, and we chit chat back and forth, and we'll all jump on a ride together and compete against each other. And that's been great physically, but also mentally. It's been really nice just to reach out and touch bases with a lot of friends. And honestly, I feel like I spent more time with friends during this shut-in than I have when I'm normally not shut in, because we have time. I'm a member of 2 mastermind groups. One is an all-female mastermind group, and one is just excellent doctors. And the female mastermind group, we meet every Tuesday at 3 o'clock on a Zoom call, and it's fabulous. We'll all have a glass of wine, we chit chat, we talk about dentistry, what we're gonna do, what we've been doing, we talk about makeup. I mean, it's just fun. And then my other mastermind group, we speak also weekly, sometimes more than once a week. And it's just really great having people to talk to. When this whole thing started, as a matter of fact, in mid-March, we had our mastermind group out in Denver, And we were hesitant. It was before they shut us down, and we were hesitant. Are we going or are we not? Because we just didn't know. Should we travel? Should we not? And we made the decision, my husband and I, that we were going to travel to our mastermind group. And we were shut in a room in a hotel for 3 days with some of our best friends in the world, while this whole thing was just unraveling and people were getting scared. And it was probably the best thing that could have happened in this COVID situation, is just being locked up with friends who really care and love you, and they're all going through the same thing. And so that's how it all started with COVID. And so when we came back, we had this great sense of peace and relief. And so mentally, it's been really, really easy, just spending time with friends, spending time with the family, doing some the family and I have been doing some yoga and some stretching together, which has been fun, doing some daily devotionals, just things you never have time to do. It's great.
That's great. Wow. Well, thank you. That is wonderful. And what about restarting your clinical practice? Do you have some thoughts of how that might look, and how much? I mean, not if it's going to affect us. Obviously, it is, but you have some kind of preliminary thoughts of how to get started.
So I will tell you, I am nowhere near as organized as Jennifer. However, I have spent a lot of time putting protocols together. I do have a PowerPoint presentation for my team. I have handouts for them. We're going to go back on Monday. Our governor has given us the okay. He said we're essential. Go back to work. But we also want to be smart about it. So on Monday, we're going to have an all-day team meeting. And we're going to spend some time just calling patients, rescheduling patients, getting everything set up. And then Tuesday, Wednesday, Thursday, we'll likely see some patients, mainly patients who absolutely need to be seen, high risk patients. We're going to try to see one patient per operatory per day. We have 11 operatories. So if we can limit it to 11 patients per day, that would be great. And that way people are going to feel, comfortable coming back in and getting a few things done, especially high risk people. And then the following week, we'll start up hygiene. We'll start up the following week, and no ultrasonic scalers, of course. And we'll just do, we'll limit it and just take it one day at a time. It's such a fluid situation. I mean, we're learning as we go. So we're just going to take it one step at a time. I have some team members who have high risk parents that they actually live with their parents, and their parents are high risk. So, we're trying to figure out how we could get them back in the office, but not have a risk for the family members. And so, I have one team member who has children that she's still homeschooling until June. And she said, I'm homeschooling 6 hours out of the day. I don't know how I can possibly come back to work. So I'm trying to work with those team members and just really make sure that we all have what we need for our families, and then also for our patients.
Well, great. That sounds, you guys have everything so together. I'm sure there's so many tips that all of our listeners can learn from that. So thank you so much, Dr. Stanley, and we'll take some questions. So I want to introduce our third panelist member today. Thank you so much for coming. So this is Dr. Jumoke Adedoyin. Hopefully I got that kind of right.
That was great. That was great.
I totally get it. So Dr. Adedoyin grew up in Nigeria and now lives in the greater Atlanta area. She's the clinical director at Affordable Care. She has completed her master's with the ICOI and is an associate fellow candidate with the AAID. She's on clinical faculty with Implant Pathways and the director at the Atlanta Dental Implant Mastermind. She's been married for 18 years and is mother of 3 boys. And I want to say happy birthday. Today's your birthday.
Thank you.
Oh, happy birthday.
Thank you. Yeah, it's been great.
Thank you so much for joining us. And so I'd like to ask you, how are you balancing things with your family at home and keeping them occupied, with the children especially?
Oh my goodness. So I have 3 boys. My oldest is about to be 19. I have a 14-year-old and I have an 11-year-old. So homeschooling is a new thing for me. And I promise you, the next time we have a teacher appreciation week, I'm going to spend so much money on those teachers. Oh my goodness. Uh, it's been a challenge, when as women professionals, like, we pride ourselves in doing so well at what we do. And so when you're faced with that challenge of teaching your kids, I do have a special needs son who, when I get home from work, like, our time together is all about just loving on him and stuff like that. And so I've had to like teach him, right? And he's looking at me like, wait a minute, you're not the teacher, you're the lover. And it's So the first few weeks was so like, it was hard. I cried because I was like, I'm the worst teacher ever. But we've come to a good place now. But it's just so hard, like balancing the whole thing. I do have to say that I've spent so much time learning my kids all over again. Like you never really think about it, and I'm there all the time. Like, and I'm actually using my kitchen, girls. Like, really, like I'm cooking a meal like every day. And last night I was like, I'm not cooking. It's almost my birthday, and my kids are like, we're not gonna have dinner. I was like, you never used to like have like 3 meals a day. We used to order out, so that's been really great. And we just moved to our house. We just moved to our dream home. So it's been a lot of time in the pool and like fixing things up and just actually being present. And I think that's probably the biggest thing is being present. I think a lot of times we think we're present, but then we're doing like 10,000 different things, right? And just being there. And like when my kid is talking to me, like I'm 100%. Like we're never like this is not nothing we planned for, but it's been so amazing in building relationships with my kids. Just getting to know them. We're never going to get this time again. So that's what I've been doing. I have tried to keep my routine the same, so I wake up early in the morning. I have my time of prayer, and then I go for a walk. I do a 3-mile walk every day, just to kind of keep the mind in a good place. And that's been great. I do have like everybody else, we kind of seem to all be thinking the same thing. I have a Zoom call with my staff at least once a week. We call it a bring your own drink Zoom call. And, we just, and like they said, it's not really anything about work, but it's really to check on them and make sure they're okay. Because you really do need to check on your team and make sure they're okay. Like we've never been through a pandemic before, but they've never been through one before. And they look to us as leaders and expect that we know more. Even like when we're talking, we all know we don't know what the hell is going on. Like we're all like in the same boat. But they need that. They need that. They need to be able to depend on us and say, even if I don't know, my doc's got it. So just kind of giving them assemblers of a structure has been really great for me. My husband and I have had dates in the yard, you know, watching Netflix, and that's been great. So that's been it. And I'm just kind of going with the flow. I've taken a lot of CE courses. Oh my goodness. But I do dedicate about 3 hours a day and just take some CE courses so that I come out of this better. I think it's important that we don't get to the point where we're not learning or growing, because when we stop growing, we start dying. So, so that's been really my thing. But more than anything, it's just really enjoying my new home and spending time with my boys and my husband, and, just enjoying like just going outside and breathing.
Absolutely. I'm sure that some of these things that you've started, you'll continue even when this is over.
Absolutely. Yeah,
Mhm.
absolutely.
So how about getting started back to practice? How do you envision that to occur?
Oh my goodness. So, Georgia, of course, I think a few people went back to work last week, but I'm planning to go back to work on May 11th. So, just like the other doctors, I do have a PowerPoint for my staff. We are actually going to go back in a week earlier. And what I plan to do is to role play what we're going to do. It's not our new normal. It's going to be different. Now, is this going to be different for a long period of time? We don't know. But we need to go back into practice, making sure that our staff, they're safe and our patients do feel safe. I think it's the feeling of safe, knowing that we've done something. So I have had a third party company come in and do a cleaning of the practice. I have put up some plexiglass, they call them the spit barrier. I have a really like an open field office, but this is what we need to do. And I've kind of put protocols in place, and we're going to role play next week, because it's nice when it's on paper, but sometimes it's not as nice when you start actually doing it. So we're going to go in there on Thursday next week, and we're going to role play, how do we get the patients in? how do we get them to fill out the paperwork? Do we take it to them in their cars? Like just kind of working through all the, everything, and making sure that when our patients do come in, that they do feel safe. And like Dr. Stanley said, we've spaced out our schedules, so we're not seeing as many patients. We're just kind of slowly coming back in. So I did furlough my staff as well, unfortunately. So what I plan to do is to bring back, I'm going to start with a staggered staff schedule. So we're going to bring back just a few, and then hopefully once we get the schedule going, then we'll bring out a few more, and then bring back a few more. But I've never said this, I'm so excited to go back to work.
I think we all are, definitely. Yes. So thank you so much for that. I really appreciate it. I'll just tell you a little bit about me, since I'm in a different area of the country. So we haven't really been cleared to go back yet. But as a university, and especially as an oral surgeon, we've had quite a lot of emergencies. So I've seen about 1 to 2 patients a day, and our residents in our clinic have been seeing probably about 5 to 10 patients a day. And so, I think in the whole Los Angeles area, this is one of the main places where the patients are getting sent. And so we've had protocols already in with all the additional PPE and the additional barriers, and the screening questions, and taking the temperature before anyone enters the building even. So a lot of these, I think that we will continue. So a lot of our protocols have been in place. I have 2 teenage daughters, a 13 and a 16. She had her sweet 16 birthday during all of this, so that was kind of sad for her, but I promised her a bit of a bigger celebration. One thing that she wasn't able to do was get her driver's license, but she got her permit. So whenever we're going shopping, I don't want her to enter anywhere, so she just drives me around, and I go in all the stores, and and she just drives the car to get some practice. So that's been kind of funny. My girls have been doing some big major workout videos at home, and so I join them sometimes. And I do a lot of yoga and Pilates, but these workouts that they're doing are just killing me, and I couldn't keep up. So I've just kind of done my own thing on the side while they laugh at me and do these major workouts. So that's been fun. But definitely, as you guys have said, to get to know your family and your kids again. And we have a pretty close relationship, but when you have more time than just, oh, how was your day? Great. How was your day? It's so much more in these in-depth conversations. And I've been doing a lot of webinars for various things, and so they want to see my lectures, and they're critiquing them and stuff. So it's been a lot of fun about how your relationship really changes with your family during this time. I agree. My 16-year-old, she's a sophomore, and her homework is way beyond me. Like I can help with some English grammar and some science, but now honors chemistry is way beyond me as well. So so I haven't really been too much of a help, to be honest. But I think that this has really taught us to be more open, and really also feel blessed with what we have. I mean, to be able to have a job to go back to, and to be somewhat stable, I think is such a privilege during this time that so many people really don't have, and to use this opportunity to really be thankful for things that we have, and our jobs and our families. And so I've used a lot of this time with my girls to show them that, and tell them how important it is. And we're not just gonna, jump back in and go on big shopping sprees and go out to expensive dinners. I mean, this really has taught us that, to be more humble and thankful for what we have. And so I hope that will continue. I kind of do a lot of that with my girls. I do a lot of volunteer work, and some in other countries, and I've taken my daughters multiple times, and just to really see about how to help people, and service, and to really appreciate what you have, and not to be upset. The other day, one of my daughters was upset that she got an A instead of an A+ on something. And she goes, wow, she goes, if I'm upset about that, then I'm, that's really not good of me, is it? And I'm like, well, no, not really, and so just this different perspective on everything, I think is just so important. And this certainly has taught us about that. In terms of the mental keeping sane mentally, mine's really been going to work every day. I mean, I had a webinar at 7 o'clock this morning, so I was out of the house and like happy to be out. And then when I get back, I'm much more refreshed. And but my work day is very different. I figured that I would get a lot of research done and make a lot of lectures and do things, but as you all said, you have to expect that your list is not going to get completed. And, I just keep adding new things to the list. So we'll just take it one step at a time, and we get done whatever we can get done. And, that's how it goes. But it's been nice not to have the pressure of a million patients waiting or people calling. But of course, a lot of the surgeries that I did right before this happened, or people that I've had to see back, and things that have occurred or whatever, and as the whole city is also sending all of their complications to UCLA, then we've also had to deal with a lot of issues and complications after surgery. So it makes me appreciate the ability to be here and to be present and working and still be able to do what I love to do best, and reach out to all of you and feel like we're connected and we're not in this alone. And that's been really great. However people have stayed connected, I think is so good to do that. In terms of getting back to work, I've had so much experience with that because we've been still working and updating our protocols, but I've also been on so many webinars where there were oral surgery groups from all around the world. We had calls where people were on from China and Korea and things, just really learning about how the risk has been in other places and how people start getting back to work. And, similar to what we were talking about at the beginning before we started our actual session, is that there are a lot of things out there that, people are going to come to you with, devices that you have to buy or treatments that you have to do, or, gargling with bleach or whatever a nonsense that is going to be said tomorrow by people who have no idea. But really taking all of that with a grain of salt and being careful what we buy into and what we prescribe for our patients or our friends that come to us as healthcare providers. So unless there's evidence for, some of these things, I really don't think it's a good idea for us to invest in these very large, equipment and cocktails that really may not have any kind of efficacy or safety. So following our CDC guidelines, our ADA, or our other professional associations that we belong to, I think really is the best way to go. And then of course, observing what our individual states are telling us is okay to do. So as all three of you have said, I mean, safety is really just the most important in terms of how to continue. So with that, I want to open it up for questions. If anybody has any questions for any of our panelists, and I'll specifically ask. We have one question here, and I'm going to actually pose it to all three of you because I think it's a really good question. Let's start with Jennifer. As someone who's a dental student, for example, and or even a resident, and really hasn't embarked on the field yet, and during this crisis is starting to get into this where things are unknown and changing, and you often think that healthcare positions are always going to be there, but of course a lot of people are either going to be out of jobs or with lesser jobs, or maybe we might not have as many patients when we open back up. What kind of advice would you have for dental students or residents that really haven't started in this new post-COVID-19 situation?
Wow, I have to go first with that one, huh? No, it's, what a great question, Dr. Aghaloo. I kind of come from two different perspectives. I come from the private practice practitioner, but also my husband is a certified financial advisor. And so a lot of, and Bobby knows him real well too. And so a lot of his clients happen to be these new young graduates, or D3, D4 students, or even medical students, or veterinary, or ophthalmology. And so what a great question. Specifically for dentistry, I'm going to say it again, we are in the best profession. And I mean that. We are in the best profession, and it will continue to be that way because of all the leaders, all of you on this call, all of us around the country. We have always practiced infection control at the highest level. And we know that. And you've got to believe that and trust that. Things are going to be different. Dr. Aghaloo, I think you put it so beautifully that, back in the 70s when we found out about HIV/AIDS, right, as a blood-borne transmission, things changed. And what did dentistry do? We adapted. This is going to be a new norm. I want to remind everybody that this is a new norm for not just you, but for all of us. So I think that question applies certainly for, new graduates and students, but as well as those of us that have been practicing 30 and 40 years. And my study club, prior to us all being shut down, we had this conversation, and our study club has new graduates all the way up to people that were practicing during the times of HIV/AIDS. And that was the exact discussion. There will be new norms. Hang in there. Do as much of your research as you can without going crazy. Know what's out there. If you are looking for positions, I know that's a real struggle right now. So those of you that may be ready to find an associateship or in the process of purchasing a practice, know what your options are, because just as maybe that door may have been closed, there's going to be a lot of opportunity out there that you may have not thought about before. So think outside the box. Have faith in yourself. You are in the best profession, and the reason you are accepted to dental school and will graduate from dental school, maybe the board testing will be different this year and moving forward, is because you chose to be in this profession for a reason.
Great, thank you. That is so encouraging to our students out there. Bobbi, what do you think about that same question?
Yeah, so, I agree with Jennifer. Nobody does infection control better than dentistry. We had this issue years ago, and for the last 30 years, we have perfected infection control, and it's only going to get better with this new challenge. So that's not the problem. The problem is not the infection control. The other thing is that people still need us. Dentistry is a preventive career, meaning that if we can prevent issues, then people don't have emergencies. So they're always going to need to go to the dentist. They're always going to need cleanings. They're always going to need things that are considered non-essential. So they're not going to shut us down. And I know there are a lot of people who are like, oh my God, are we ever going to go back to work? What's going to happen? Are they going to limit my income? Are they going to limit my patient seeing ability? And that's not going to happen, because people still need us, and we're here, we're essential. And so there's still opportunity there. So what we have to do is we really have to get our infection control to where it needs to be according to the CDC and the ADA, and then we need to treat our patients. COVID is here to stay until a vaccine comes along. We have to learn to live with it, whether it's in the dental office, at the grocery store, at the gas station. We have to learn to be very preventive no matter where we are. And we're really good at that as dentists. So, dentistry is still just this fantastic career. I say, you guys, you've chosen the best career ever. Just go for it, continue, hold the course, learn as much as you can learn, and take the precautions in infection control. You're going to be fine. We're going to be fine. They will come out with a vaccine for this. And then a year from now, 2 years from now, all this will mean nothing. We just have to get through the little bit of time until a vaccine comes out. And that's it. We're going to do that. We're going to do it together, and we're going to take care of our patients, because that's what we're due. We're doctors. We're going to take care of our patients.
Well, thank you, Bobbi. No, that's super encouraging, of course. So let me ask the same thing, Jumoke. What do you think about that?
Yeah, so I do agree with the two ladies, but also think about this. We have perfected infection control to take care of hepatitis, which is, we do this every day. I think most medical doctors are having a hard time putting on a mask every day. It's something we do. Like, that's our middle name, infection control. So, I don't think we'll have a problem there. It's just adaptation, and we've been very adaptable. Just if you look at, like she said, from the time of HIV to other infectious diseases, we've just been very adaptable, and we just need to step it up a little bit. But in terms of a profession, I'm going to talk to our audience, which are mainly females. Like, this is like, I'm a proponent of that elusive work-life balance that doesn't really exist, but then we say exists. This is probably the best profession to do that, to be able to have a work life and have a regular life, and being able to merge the two. So, you know, if you're already a third-year student or fourth-year student, you've made the best choice. This profession has allowed me the ability to make my own schedule, be a mother, be a wife, be whatever I want to be, and at the bottom of that, take care of the patients. You know, the reason why you went to dental school was because you have this desire. There is, you know, one thing I found out with all the really just spectacular doctors is there is a passion for dentistry. You know, it's not about the money, it's just because you do have that desire to care for people. And I think that's the reason why most people are on this on this today. So, you know, just follow your heart. Like, dentistry is not going to change because of COVID-19. Your heart desire is not going to change because of COVID-19. Your desire to care for people is not going to change. We're just going to have to do it differently. And, you know, if you think about it, before September 11th, like, I used to walk all the way, like you guys said, you know, my family's from Nigeria. And when my mother-in-law was going back to Nigeria, we would walk all the way to the gate, right? And now we had to go through security. And, you know, I was telling my son, my 19-year-old son, like, that was what? He was like, what? That's how the airport? I was like, no, there was no security. You just walk through. And at that point, we were like, oh my God, this is so strange, because that was the new norm. But then we all adapted, people. So this is just going to be another adaptation. Like, you know, in 10 years, we're probably going to do PPEs a little differently, but that's all we're going to know. And it's always going to be for the safety of everyone.
Great. No, that's really a great point. You know, already in things that we're talking about here, we're going to have less people waiting in the waiting room. We're going to have more social distancing. Everyone's going to feel safer. And, you know, some of our staff that have been coming in have said to me, I actually feel safer here in the office, in the clinic, than I do at the grocery store. I know that all the surfaces have been disinfected with the proper, you know, solutions. I know that everything's been cleaned after every patient. I know that we're using all the appropriate PPE to prevent any spreading. Everyone's wearing masks, everyone's wearing gloves. But when I go to the grocery store and I see, you know, people coming in, and who knows, you know, people wearing their masks incorrectly, or, you know, not wearing one, or whatever the case may be, we don't really know what anybody else is doing. So I think that we're absolutely going to be able to take care of that. And I think especially for students that are just starting out, if this is going to be what you begin with, then you don't even have all this baggage of the old way it was done, right? So you don't have to reinvent yourself or relearn something new. It's going to be from when you start, whether you're starting this year or you're going to start in school the next couple of years and then take it, you know, out with you to practice. So sometimes being a young practitioner is going to have an advantage, because you don't have all of these things that you have to, you know, change or unlearn or whatever. So I really think that it's still the greatest way. And it's also, now that we have all this distance learning, I mean, you know, we're going to be used to learning on Zoom and all these other platforms. And it's not that we have to be in person all the time. We can be much more productive. I have a bunch of, you know, grant review meetings that are going to be virtual like this. And I'm a little bit scared of that, because how are people going to really express their opinions? And are you going to see the scowl on my face when I read something that is not so good or whatever? But, you know, I feel like I've gotten way better at expressing my emotions online. And remember, all these people, the young people out there, are Instagrammers, and, you know, and so you've all Snapchat, everyone's been out on all this media. So this is really an extension of that. So I think that, you know, we really don't have too much to worry about. So with that, Cassandra, I want to send it back to you to kind of wrap it up. But I appreciate all of you so much for joining this panel. I think it was super informative. I know I learned a ton, and I hope that that everyone out there has. This is it's been recorded, and so it's going to be archived for people to be able to download and watch. And I think that hopefully it will be helpful to people, and just encouraging everyone to, you know, keep our heads up and know that things are improving. And with that, I'd like to express the appreciation from all of us on the panel, and thank you again, Cassandra, for supporting this initiative.
Absolutely. I definitely appreciate you guys so much. And I do want to say there was a couple other comments. So I know several of the ladies made comments about enjoying a lot of your thoughts with everything. So I definitely appreciate all of you guys and the leadership that you guys are bringing to your practices, to your families, as well as to the industry. I think you guys provided a lot of really great insights for the attendees here today, as well as other attendees who weren't going to be able to join that will be listening later on. So I definitely appreciate you guys taking the time to share your thoughts and provide great examples to everyone. So thank you again for your time, and hope you guys stay safe, stay healthy, continue to enjoy the time with your families, and hopefully we'll see you guys back practicing very shortly.
Thank you all
Sounds
so
great.
much.
Thank you.
Bye-bye.
Thank
Take
you.
care.
Bye,
Thank
guys.
you.
Bye.
Bye.